continue to provide regular updates and information as often as we think it's helpful, and a number of questions have come up that we're going to continue to answer. I said yesterday the key to slowing the spread of the coronavirus is with us, being responsible neighbors to each other. And today, the Detroit Pistons showed us what being responsible neighbors really is. The steps they took today were just extremely positive. And so many of you know what happened last Saturday night. The Utah Jazz played the Pistons at Little Caesars Arena. Two Jazz players, Rudy Gobert and Donovan Mitchell, subsequently were diagnosed with COVID-19. And as we've talked about and we'll continue to talk about, the primary means of the spread of this disease are the droplets from your mouth. Somebody within 6 feet of you, breathing on you, sneezing on you, coughing on you. That's the primary way the disease is being transmitted. And playing in the NBA up against the player is exactly the kind of high-risk activity that could lead to the spread of the disease. The NBA did the right thing in suspending the season for the protection of its players and staff. I started the day on the telephone with Arn Tellem, who runs the Detroit Pistons, and they were totally on top of what they should be doing. They coordinated with Denise Fair and the city health department all day long, and they have self-quarantined their players, their coaches, their staff, their travel team, people who could have been directly exposed to these players, and have removed them from potential risk of spreading to the community. And that's what we are asking folks to do. In addition, they closed their headquarters and practice facility. They have their employees working from home while they thoroughly clean the practice facility and headquarters to make sure that there are no remnants of any germs. This is the kind of proactive steps that will help us. And the health department staff was also proactive. They went out and visited the hotel where the Utah Jazz stayed last Saturday and were very satisfied with the appropriateness and the thoroughness of the cleaning protocols and found no reason to have any health concerns at the hotel. That's how we're going to respond to everything, and we are going to slow this as best we can. I want to, in particular, thank Dr. Mark Zervos, Z-E-R-V-O-S. I think you're going to come to know him quite a bit. He is the chief of infectious disease at Henry Ford Hospital and an associate dean of the Wayne State Medical School. Dr. Zervos oversaw the Pistons' response today, but by the end of the day, we had drafted him. And Dr. Zervos has agreed to be the advisor to the Detroit Health Department through the balance of this effort, and he'll be here at 7 in the morning in the room with the team. So we have an outstanding team with our health director, Denise Fair, with our medical director, Dr. Romano, but we now have one of America's leading authorities on infectious disease, and Dr. Zervos fully integrated into the city of Detroit response team. And the recommendations that we are passing out to you today are a result of our consultation with Dr. Zervos in the course of the day. I can't say enough about Henry Ford Hospital and how generous they are. I talked to a whole lot of folks in this town, and the infectious disease teams at all the hospitals are swamped. Henry Ford made a commitment to us to do this, and it's going to make a difference. I need to talk to you about the difference between primary contact and secondary contact. All day we've been getting calls at the health department for people who were with somebody who was sick. My sister was at a facility where somebody was very sick. My coworker's mother is very sick. Do I have to go home? And it's a natural kind of a feeling, and this is a place where the media can be very helpful. If you've had primary contact with somebody diagnosed with COVID-19, we need you to self-quarantine for 14 days. If you've had secondary contact, there's no medical reason for you to self-quarantine. So let me talk about what that means. The Pistons players who were on the court with Rudy Gobert were within 6 feet. And that's what we mean by primary contact. You were within 6 feet, essentially exchanging breaths or sneezes or coughs with an individual. You need to self-quarantine, which is why the Pistons are self-quarantined. But if on Monday you happen to have gone up to a Pistons player, asked for their autograph, and had a conversation, that's a secondary contact. There's no medical reason why you, having a secondary contact, need to self-quarantine. And so our recommendation is that the 14-day self-quarantines should be done with those with primary contact. Now, if you have had secondary contact, you certainly, like everybody else, should be conscious of symptoms. And by now, I hope we all know the 3 symptoms of COVID-19: fever, coughing, shortness of breath. And if you have those, you get to your doctor. But right now, we are self-quarantining those who have primary contact. A couple items that have come up. One is a question about the schools. And after consulting with Dr. Zervos, Dr. Khaldun at the state, and our health department, we are not recommending the closure of public schools at this time. There are no diagnosed cases of COVID-19 in the city of Detroit. There's only 2 in the state of Michigan. And so the recommendation is that there is not a medical benefit to closing schools at this time. If there is a point at which there is a spread of the coronavirus in the community, that recommendation may be revised, but today we are not recommending the closing of public schools. And with regard, now, as far as the schools go, and I don't even need to say this to school administrators, Dr. Khaldun has posted a set of recommendations at the schools not to hold assemblies, try not to have people packed into cafeterias. Your issue is not children spread out through the schools. The issue is when they are packed in close together is where the risk goes up. And I know the schools are following the state recommendations in that regard. With regard to the churches, our position is the same. We'll leave it to the judgment of the individual clergy. And again, the state has given recommendations if you're having services. Make sure you have hand sanitizer. No handshaking or hugging or touching as part of the service. You've seen a number of denominations start to adopt these kinds of restrictions, and we'd like to see the congregants have as much space as possible. It is being packed in together that increases the likelihood of the exchange of the droplets that spread this disease. But we are not, at this point, directing churches not to hold services, but we hope that when they hold them in compliance with the state guidelines that are on the state health department's website. And so we are going to keep doing exactly what we're doing and preparing. We have another day with 0 diagnosed cases in the city of Detroit. We are preparing for the very high likelihood that we will see cases. And we're studying closely what's happening in Seattle and New York. And it's interesting to see the different trend lines. In Seattle, where they have over 300 diagnosed cases, they've had 29 deaths. In New York, where they've had over 300 diagnosed cases, they don't have any deaths, at least as last I saw earlier today. Difference is Seattle got concentrated in nursing homes, whereas New York tended to get concentrated in healthier communities. And so we are in constant contact with the cities in this country that are several weeks ahead of us as far as exposure. We are learning from them, and they've been really great partners. And now I want to turn this over to the person who is leading this, and they started off at dawn in the war room, and they'll be here well into tonight, and then we're getting back together with Dr. Zervos in the morning, but she's doing a terrific job, our health director, Denise Fair.
Thank you, Mr. Mayor. The mayor has done a really good job of providing a comprehensive overview of where things stand today and what we're planning for in the near future. So I do want to take just a few moments to echo Mayor Duggan's comments, particularly as it relates to the Pistons. So as the city's chief public health officer, I first want to applaud the Pistons for how quickly they responded to the coronavirus. That's exactly the type of quick response that we're really looking for, and businesses really need to follow their example. So the Detroit Health Department, we were able to connect with the Pistons right away, and again to provide them with the guidance and actions that they needed. And again, their example is how we want other organizations to address this issue should it arrive to their door. The Pistons took the proper internal actions, and they worked openly and closely with the city and other state health officials. Now, the hotel that the Utah Jazz stayed at was also extremely responsive as well. The health department investigators arrived on the scene right away. They cleaned, they helped to review the cleaning procedures, and it was determined that they had an effective cleaning and sanitizing program. So we are going to stay in constant communication with the Pistons, again, to reduce the spread and the potential spread of the coronavirus, because we expect that sooner or later this will start to touch more businesses in the city. And I want everyone to know that the Detroit Health Department will be here to help businesses as well as the community navigate the issue, so that together we are all doing everything that we can to stop the spread of COVID-19. I also want to personally thank my staff at the Detroit Health Department, particularly the communicable disease, the emergency preparedness team, for being so responsive and engaged, particularly the investigators. And again, we want to coordinate with businesses, and the Detroit Health Department is here to help you. And as a department, as a city, as a community, we all have a very important mission, and we all need to be focused on, which is to slow the spread of this virus. So with that, I'll turn it over to the mayor for questions.
Anybody have any questions?
Can you go back on the incident with the players and what I missed the name of the hotel and?
So I'm not going to name the hotel because there's no reason to cause them any business problems. We're trying to keep people employed. We wanted to go out and verify for ourselves the cleaning protocols were appropriate. The team left, last Sunday, and the health department staff went out. They were satisfied and concluded there's no reason for anybody to have any concern about it. There's no reason to put the hotel in the paper.
It involves the two Utah Jazz players.
Well, the Utah Jazz stayed at a hotel when they were in town for the game, and so they flew out Sunday morning. We went. There's no reason to think that by Thursday there are leftover issues, but we wanted to go through and be satisfied with the cleaning protocols at the hotel. The health department verified them, and there's no reason for concern as far as we believe relative to the health standing at the hotel.
But can you clarify how long they were there?
How long the team was there?
Yeah.
The Pistons could.
The hotel.
Yeah, I don't know if they came in Saturday morning or Friday night. The Pistons could probably tell you that.
And it was a downtown hotel?
Yes.
Can you elaborate on the economic impact you expect the coronavirus to have? Obviously, several large events already been canceled.
Yeah, the best way we can minimize the impact of the coronavirus is to minimize its spread and protect the health of our citizens. And so I don't have a crystal ball. We are working every day to minimize the spread. If we minimize the spread, this will be a relatively short-term financial problem. If we fail to minimize the spread, it'll be a major problem, and I can't tell you at this point which it will be.
Mayor, do you think that casinos should shut down since there's so many people coming from all over the area?
Again, we have not seen any evidence of a problem at the casinos, but that is something that we are looking at. And if I were at a craps table, I wouldn't be standing shoulder to shoulder with the person next to me. But I'm not sure how crowded they have been. We don't have a legal basis at this point to do anything. The health director has the power to step in when there's a health risk. When you have not a single diagnosed case in the city, you don't have any legal basis to step in. And so we're talking to the casinos constantly about their practices. They've stepped up their cleaning efforts and the like, but we don't have any basis to do anything at this point.
Hey, Mayor.
Yeah.
I want to touch on the Pistons and then I also want to talk about the schools. The Pistons, have those players been tested yet? And if they have been tested, when will those results be back?
So you've got privacy issues, and I would direct you to the team, but the NBA, in fact, I went to speak with Arn Tellem before I came in here, and he was on a league-wide call with Adam Silver. The NBA is responding to this in a very aggressive and responsible way, but I will let the Pistons talk about their employees and what their various medical testing is. It's not my place to say that.
We're just curious because the Jazz players, they came out and released their names.
And so you have what HIPAA violations. So the Jazz can decide to release their own medical records. I can't decide to release medical information. But I will again say, as of now, we have no diagnosed cases, and the Pistons will need to talk about what their testing is and what those results are.
And then just about the schools, we know they're the most vulnerable inside those walls. Are you concerned at all if the schools do close about the children who rely on going to school to get meals, who rely on that time for their parents to go to work?
Dr. Vitti and I have already started conversations about if the schools close, what we do to provide those hot lunches and how they get distributed and the like. It is very much on our minds. And so we are preparing for that possibility. I hope it doesn't come. But there's no question we have a number of children in this city. It's the reason why we're doing 30 rec centers this summer, is those children oftentimes rely upon school for their only good meals of the day, and we are keenly aware of the situation. And Dr. Vitti and I will have a plan before that day gets here, if it does get here. It may not, but we'll be ready.
Let's assume the day does get here. Have you put out protocols, procedures to your first responders?
Again, our first responders have protocols and procedures all the time. Our first responders every day are dealing with patients with flu, with TB, with HIV. They have communicable diseases protocols every day. Our first responders are don't need any additional coaching. They're keenly aware of how they're handling it, and they've been great.
But at the ERs, we see nurses with face masks. suited up.
So you'll have to talk to the individual hospitals on their protocols, and typically what you do is if somebody is contagious, and I have a family member right now, not anything to do with flu, who has an infection, you put the mask on the patient so that the droplets don't get out. As you've heard, I'm sure, the mask is not nearly as effective at keeping the droplets from coming in. But the hospitals can talk to you about what their protocols are. But again, there was a time in 2009 we had the H1N1 flu, and that was the point at which I required every employee of the DMC to get a flu shot. We had masks, we had protocols. The hospitals trained for this, they know what they're doing, and I would refer you to them as far as how they're handling it.
But no new information to the EMTs or firefighters.
Again, I don't know how to say this to you any more clearly. EMTs, every day of their lives, are conscious about communicable diseases with the patients they interact with. They are heroic, and they are doing their job right now.
Your Honor, in H1N1, I remember the health department providing shots, and it was a much bigger
Right.
department back then, and being
Right.
more involved in dealing directly with the public.
Right.
Does the health department have tests for people who are concerned they might have the coronavirus? Or what is the point at which the health department will deal with Detroiters on a one-on-one basis?
So the health department will send you to your primary care doctor. If you don't have one, we will get you a primary care doctor. Of course, with H1N1, there was a serum developed, and it was made part of the flu vaccine for that year. We have a situation now where this came up so recently that the vaccine didn't account for this possibility. As far as tests go, the state of Michigan has a number of tests. It isn't necessarily the health department, but every doctor has a protocol on when you run a test for coronavirus. And it isn't everybody who has the flu. We'll have 500,000 Michigan residents, literally, will get the seasonal flu this year. We aren't going to run 500,000 tests. But doctors have a very specific set of protocols on when to run a COVID-19 test. Dr. Zervas told me earlier today that the physicians in this state now have sufficient test kits to run tests on everybody they deem appropriate. And he tells me that that's not a bottleneck. 2 weeks ago, I was hearing from practitioners that test kits was a concern, and maybe they were making decisions not to test people that they would have liked to have tested. At least what Henry Ford tells me is, and Dr. Caldoun can answer this better, that there are enough kits to test everybody doctors feel need to be tested.
But the city won't be giving tests.
Now, the city doesn't give tests. The city will send you, do we? We don't have tests, do we? So we are out of the primary care business, but you've got a great primary care network between the health systems here, and we've got access to all of them. Yes.
Go back on this, but the hotel. I realize the health department responded on site and feels that the cleaning was adequate, but is there a possibility that other guests were exposed? And if you're not naming the hotel, how can people know?
So if you were within 3 to 6 feet of Rudy Gobert or Donovan Mitchell in the last few days, you should go see your doctor and you should self-quarantine. That is the message that we have communicated. They are the 2 diagnosed cases. And if there are other, and this is how we're doing with everybody. This is the way it's being done nationally. You go to any of the other states, once somebody is diagnosed, the investigators go back through and try to identify.
I'm not trying to argue, but just clarify for folks. This can live on surfaces, so it may not have been a direct, 3 feet, whatever
Right.
you
So-
mentioned. Couldn't that have been a possibility?
So everything is relative risk. It is possible you can get it from a surface, which is why we clean surfaces. It's possible you can get it from a handshake, which is why we tell you to bump elbows. But it appears the primary transmission that's occurring in this country is direct contact with sneezing, coughing, water droplets of the other individuals. So I won't tell you it's not possible, but when a hospital does a thorough cleaning job, the health department has assessed this as very little risk. The hotel, I'm sorry. And so assessed the hotel as very little risk. Had we gone in there and found that the rooms hadn't been cleaned, they might have reached a different conclusion. But there's no reason to think that if surfaces are regularly being cleaned, that they are high-risk areas.
Your Honor, are you considering closing city recreation centers or city pools, which may end up having more than 100 people congregate there for a program or anything like that?
Not yet, and what we do have is folks being very vigilant. We've trained staff at all of these centers that if we have people coming through who are exhibiting signs of the flu, we are quite firm but polite in getting them to leave. We have not seen the rec centers as being a source of a problem, but we are monitoring it every single day, and the first report we get every single day is, what are you hearing from the rec centers yesterday? So we're on it, but we haven't seen a reason yet to close it.
And those, for the doctor, maybe, those hotel cleaners, is there a risk when you're cleaning these facilities? Can you clarify?
So I'm not a doctor, couldn't pass my MCAT, so I became the administrator. So to your question, I'm making sure that the team, when they go out there to look at the protocols, that they are protected. And we're also making sure that we connect with the hotel staff to ensure that there is limited risk. At this point, there is no risk, but we will follow up and just make sure. Thank you.
And will Dr. Zervis be meeting with city officials every morning at 7 o'clock, or is this just a Friday?
So I think I have a pretty good commitment from Dr. Zervos and Henry Ford that it will be daily consultation for as long as this is a threat. It was extremely generous of Henry Ford and Dr. Zervos to make this commitment. We got a great team here. We do not have a world-class expert in infectious disease that happened to be on the city payroll. And so this is an enormous addition to the team.
And is this a new thing that you'll be having these meetings every day until this crisis is clear?
we were having the meetings regularly. Tuesday night, when the state announced the first 2 cases, they've gone to every day, and they will stay. I'd like to say they were just every day. They literally start first thing in the morning, and I think Denise is probably going back to it right now. If you saw the magnitude of our responses on every aspect of government and the number of questions that we're fielding, and the continual consultation with Seattle and New York and Boston on what they're learning, so we're ahead of the curve. We have saved so much time by being able to consult with folks who have already dealt with these issues. It's been really good. So we're going to keep meeting every day. I don't know that we'll talk to you every day, but if we have something new to say, we'll keep doing this as long as you show up.
Is that 7 days? When you say every day, I mean, or is it Monday through Friday? I'm not trying to make more work for
Again, right now, I will tell you on Saturday. So right now, it is every day. If we get to the point, but we have no idea what's going to happen tomorrow. We could have our first case tomorrow. If that happens, we'll be here Saturday and Sunday. So right now, we're taking it one day at a time, and I'm just really pleased at how the team's performing.
Are any city workers self-monitoring or self-isolation or?
Yeah, and I'm not going to talk about anybody's individual case, but we have no evidence of primary contact of any city employee with anybody diagnosed with COVID-19.
Mayor, real quick, you said that if someone did not go to primary care doctor, you would appoint them to one. Does that also include free testing?
Again, what you have in this state, Obamacare is a great thing. And so we will get medical care for anybody that needs it. It isn't nearly as difficult as it used to be before President Obama, but the answer is yes, we can get everybody who needs testing to get testing.
Mayor, do we have any updates from the water department?
Yeah. Today's numbers were almost identical to yesterday's. I talked to Gary Brown. He gets you the exact numbers, but about 150 more people have orders to restore water. Yesterday, I think it was 140, but it was 150 more today. 200 more people who had gotten a warning for a notice had that warning rescinded today because they came in and made the $25 payment arrangement. So basically the same numbers as yesterday. Good, steady program. We've got 8 crews out restoring water right now, and it is working the way that we had hoped. And I hope this continues, that we get people continuing to call in and ask for help, because the reality is we have 1,000 more people in payment plans and getting help from us today than we had 3 days ago. But it looks like the program is working. So we had yesterday about 300. I shouldn't do this from memory, but I think yesterday it was 300, maybe 140 shutoffs at 160 that we rescinded notices. Today was another 150 shutoffs being restored and another 200 notices that were rescinded, so people never had their services discontinued. Gary can get you the exact numbers, but they're very close to that. All right? Thank you very much.